All right, folks, I'm going to drive to my chiropractic appointment here. Yes, I'm already at our office, but we're going to pretend for a second that I'm in a car and I'm driving. Got it? Okay, in a car driving. So most of us, because we're obviously not just right-handed, but all of our brake pedals and things, we have to use the right, we're kind of shifted over or forward a little bit. That changes the low back a lot. Also thinking of the low back in these areas, some of us have back supports in the car or have some lumbar support, but what happens is the headpiece is always kicking us forward, which causes these to be tight. Now it's nice that they do that, and the fact that every inch our head is off the headrest, it decreases whiplash about 10 times, so that's a win if you get in an accident. But from every other day, you're like this. So I recommend is to fold up a small towel or use what we call a back vitalizer to go behind you. It's a little air-filled back support that we sell, but it goes right back through here and it pushes up like this, just enough, a little bit more than what the car seat does, and it brings you into this position. So your head can still be back against the headrest, your upper back should touch, but you do have a curvature in the low back. Now again, a lot of us get into these situations, and what happens in long car rides is we cramp up, or we get what's called subluxated, meaning there's pain in the thoracic spine or these areas, there's nerve interference right through here. So what we want to have is that up, and we want to have it this way. A quick tip, if you always find yourself shifting like this, if that's how your car is, or you're on these long car rides, fold up a dish towel in thirds and stick it underneath your leg. And what happens is you don't have this all of the time, but just for about 2 weeks or so, when you get in the car, you're going to get on that and go, oh, and just kind of get back to the middle. Another thing to think of is like, where's your belt? If your belt is right here in the center and you're shifted this way, now it's off. What you want to get are things balanced so your belt is back in the center, your belt buckle. All right? So you want to try to be close enough to the steering wheel, arms like this, like we've been taught, 10 and 2, or however you do it. But the biggest thing is to remember to have that curvature in the low back and then have your head and back against the rest.